Well, Lewis, with this uptick in COVID cases in our area that we're seeing, I reached out today to an expert at UF Health who I spoke with at the start of this pandemic because I wanted to get his take on what we're seeing right now. About 100 days into this pandemic on the First Coast, Marko Predic, an infection preventionist at UF Health, says there's a noticeable difference in who is now getting admitted to the hospital compared to early on.
The ones being admitted are actually not as sick as the ones that we were seeing prior who were getting admitted to our intensive care units. We're seeing more patients who are getting admitted to our general floors who have some of the signs, some of the symptoms, but we aren't having more patients come in who are requiring vents, at least at our facility.
He says he is seeing a younger, healthier population contracting COVID-19 as restrictions are lifted in phase 2 of reopening Florida.
When they do pick it up, they don't have compromised immune systems, so they're able to fight it off a little bit better, but the threat is still there that they may spread it onto a more vulnerable population, so we do want to be mindful.
As for how the coronavirus is spreading,
the threat of contracting coronavirus, the COVID-19 from a surface is a lot less likely than person to person. So the community threat of it living on surfaces isn't as great, according to literature, as when we first didn't know much about it.
The best way to stop the spread, he says, is to self-isolate if you're feeling sick. And
just the simple power of wearing a mask, hand washing, and protecting yourself, it is working. We, at least at my facility, we haven't seen a lot of spread throughout the staff, and we do see these patients, and just taking simple precautions helps prevent the spread greatly.
Now, he told me he does not think what we're seeing right now is a second wave. He believes this is still part of the initial outbreak that now has the ability to spread because there's simply more people out who are intermingling. But he says the difference this time around is that we're now better able to handle it. He says we now know how to stop the spread, and also we are able to identify people with COVID faster thanks to all of the widespread testing that's going on. And Lewis, looking at the percent positive, that he says is the key to determining if this spike in cases is due simply to just more testing. And so I know you've been taking a closer look at the percentage positive numbers tonight.
Great point. And you know, yes, there has been more testing. In fact, 3 times more on average testing done day to day now than what we saw back in the early days of this, back in the early April, late March time. So looking at that percentage of positive across Duval County, if you look day to day, that is certainly beginning to show signs of ticking upward. This shows the daily results in Duval County since May 20th overlaps with the number of tests each and every day that's been done. And you can see now Duval County, at least in the last couple of days, nearing that 6% of positives coming back.